We'll call the meeting to order of Health Committee, and the first order of business is the approval of minutes from the September 28th meeting. Can I have a motion, please? Okay, second, Betty. Okay, are there any corrections or comments? Okay, all those in favor?
Aye.
Any nays? Okay, that's unanimous. Moving on to informational items, Board of Health, and I guess we'll combine that with EMA. So, Jason, Monica's unable to attend
Yeah,
today.
Monica's not, am I on? Can you hear me?
Yes.
Okay. Did you have questions specific for, I guess, Board of Health or Health Department? She didn't send me with anything. We talked about it early on. I know that we've got vaccine clinics are going and walk-ins at the Health Department if you need people. Boosters started, so.
Okay. Great, okay. That's, just go ahead and, I don't think we have an EMA report, or I'm sorry, a care and treatment, so we'll move on to EMA.
Okay, great.
Okay.
EMA, you've got in front of you, or I submitted my report, so the significant events, we continue our COVID. The meeting attendance, include that, just so you can see we're really getting back to what I think many county agencies are doing, is dealing with COVID while going back to business as usual for us, so. Again, with the training, some participating in the exercise tabletop as a community partner. Our equipment status with our sirens, so we continue to watch the sirens. We've got some sirens still needing some repairs. Biggest issue is really just getting the parts to do the repairs. So I don't know if you'll see in this report if it was the last one, but we did get a hold of, I think it was 3 speakers and an amplifier, so we repaired some previously, and so these are the sirens that, and if it shows one bad speaker, typically it's probably an 8 speaker or 6 speakers, one of the, so it's not, it functions just not full capacity. And then as a health department or as an EMA, kind of the dual role, we participated, Monica and I both, in an interview with, I don't know if it was CDC or if it was FEMA, but it was on the healthcare, the Pandemic and All Hazards Preparedness Act. So what they're doing, that act's coming up for reauthorization, so the federal government's looking to see, reaching out to locals, and they submitted or requested people who had interest. We submitted a request or interest. They selected us, so we did that. Additionally, with the strategic plan, we've talked about how the city and the county, the merging of that with regards to the plan and the Emergency Operations Center. The other thing was the ordinances, and Monica had worked with the state's attorney's office. They'd reviewed the ordinances. Monica asked me to provide her back my comment and some red lines that I provided to her. I think it was yesterday morning, so we'll continue to move forward on what that may look like in the future. That's it. Life is good in EMA.
So talk about the equipment, the status. You say it's hard to get parts. Does that mean the equipment is very old, or?
No, it means that there's a supply chain issue.
Okay.
So that's our biggest issue. So it's got nothing to do with our equipment. It's just
Okay.
the same issue you're seeing across the board,
Okay.
supplies-wise.
Okay. Are there any other questions for Jason? Go ahead, Jennifer.
I have a question, and it's more of a Monica question, so it's not a huge deal if you can't answer it. But any updates as far as boosters that people may need to know, that you want them coming to the health department or you don't want them coming?
Our website's the best place. I know that they're doing the boosters at the health department walk-in wise, and so I don't think that it's an issue. I mean, we'll take walk-ins. I believe they're doing all 3 vaccinations. Yeah, 8:30 to 4, if I'm not mistaken, yeah.
Any other questions?
I think Coach got a question.
Go ahead, Phil.
I'll just comment on that. I had my booster today. There's no wait. I did it at the health department. It's room 125, I think. And you just walk in, go to your left and walk all the way down the hall and meander in to the big conference room. And I think this committee met in that big conference room one time. And the woman gave me my booster, which was Moderna. And I said, no, I need Moderna. And I said, I assume you got Pfizer as well. She said, yes. Now, I didn't ask her about Johnson Johnson, but I'd almost bet they've got them all. It's not tough, people, if you want to do it.
So Jason, do you know what the, I want to say qualifications are? You have to have the shot more than 6 months ago, is that correct? And then is it just people who are immune compromised, or are you taking everybody?
I think that if you answer the questions appropriately, they're taking everybody. So like, for example, they're just gonna ask if you fall underneath the current requirements of the compromised immune system, X and Y, and so they're not asking for proof of any of that. So.
Okay. Phil, did you have something else?
Again, I will try to, answer it the best as I can. When I turned my sheet over after I filled out the one side, the woman said, "Oh, you don't pay attention to that." I says, "So you don't have to have any of these met?" She said, "No."
You're welcome.
Good afternoon, everybody. I don't have a lot since I saw you last. I'll follow up with Jason's conversation because anyone working in congregate settings is definitely eligible for a booster. So Monica came on and talked with our school superintendents here 2 weeks ago about the possibility of school personnel getting that done. Also on that call, she discussed with them some of the new issues with, excuse me, quarantine, test to stay, some of the other things. And we're very excited, gearing up for the 5 to 11-year-olds to be able to be vaccinated. And due to short staffing that everyone's experiencing, not just schools, but hospital staff as well, we're not going to be able to do school clinics, but we're ramping up to do clinics with the actual OSF and Unity Point staff in their locations. And then we'll try to do a sweep to our schools that are lagging behind somewhat. So that's coming. We're hopefully those first couple weeks in November. That's very exciting. Other small things to let you know, Career Spark launched. Career Spark is the big event that we hosted at the Civic Center for several years in a row. 8th graders need to have a career exploration experience. Well, it's one thing to ask every employer to go to every 8th grade in Peoria County. Instead, we do a communal event at the Civic Center, and we had almost 5,000 kids go through that. It's virtual again this year, so they go, it's really, you go into, it is generic, you go into like a civic center into the rooms. I think it's hysterical because it looks just like a conference hall, and then the kids go in the little rooms with their avatar and get career experiences, and then they can revisit it over and over, and then hopefully do that with mom and dad. So that is still live. It's live as we speak. Several thousand kids through Peoria, Tazewell, Woodford are all registered to go through that experience. It's our big partnership with Junior Achievement and the Greater Peoria Economic Development Council. 2 other little things to let you know. Right now, the Illinois Principals Association is hosting their conference over at the Civic Center. So we have several local people that are presenting at that. We helped host that booth. And I just got my first picture, Phil. The first stake went in for state cross countries coming back this year. Woohoo! That's in 2 weeks. Playoff football this weekend. Very exciting. Brian's out there making Lawless work hard. Questions for me?
Okay, well, I just want to let you know that Gretchen texted me, and here's the information on the shots. Pfizer and Moderna, 6 months after completion of the 2-dose series, and individuals who are 65 and older, 18 plus who live in long-term care settings, 18 plus who have underlying medical conditions, 18 plus who work in high-risk settings, 18 plus who live in high-risk settings. Johnson & Johnson 2 months after receipt of initial Johnson & Johnson dose, and individuals who are 18 plus. Thanks, Gretchen. Okay, moving on, sustainability, I don't see Becca.
No, Madam Chair, Becca's not here today. She's dealing with a family medical issue, so I apologize. And she apologizes for not being here. Her report is obviously in the packet, so I'm happy to try and answer any questions you may have regarding it. Second, landfill update. Landfill committee meets tomorrow afternoon, if my calendar is correct.
And that meeting was not properly noticed, so it was canceled.
Okay. Well, I haven't got the email canceling it yet, but good to know. Happy to try and answer any questions about the sustainability update. Just update the committee. Member Pastucha sent an email over the weekend about some findings from a US EPA compliance website. We're looking into each one of those to see what the issue was. I know one of them for sure has already been, and we've got the documentation from Illinois EPA that it's been resolved. The other ones, I know one or two of them may be just a function of some untimely report or renewal application issues that we've got to work through, and we're obviously doing that. So, but there's a couple other questions she asked about, and so I'm working to get some answers for her on that.
I didn't have my
They're in
microphone,
my
so, yes.
microphone on. All right, so I've got a quick short slide deck to kind of give an overview of where we're at. And then we've got members of the design team present that they can kind of walk through at a high level what they're working on. And we'll talk about a schedule as well. So, familiar project workflow that we've seen. It is updated to kind of show where we're at in the process. And where we're at is we're in what staff is calling a discovery phase. There's a whole lot of work going on in the discovery phase, and there's a more detailed slide later on here that will walk through that. Schedule-wise, working with the design team, we expect to have a report for the committee to review and digest potentially as early as your meeting next month, but it also may be your regular December board meeting or committee meeting. If you've looked far enough out on your calendar, the December committee meeting is scheduled for the Tuesday between Christmas and New Year's. We're going to be moving that to the first week of January. But so it could come as early as next month or that following meeting. And then once you've had an opportunity to digest that information, we'll bring forward a recommendation on renovate versus replace. All the while, we're doing some additional analysis on location should the decision be to replace. And then we'll be in a position either a month or 2 months following the renovate replace decision to bring forward a recommendation on location. So just to refresh everyone's memory, the pre-phases of the project we are complete with. That dealt with you appropriating money into this year's budget, and then us starting to work on the procurement for the design team services, which is what phase 1 was, and that is now complete. You having awarded contracts to the various components of the design team. We're now in phase 2 of the project. We'll have opportunities like today and next month's meeting for you to hear from staff and the design team about progress. You'll have an opportunity, as I just said, in an upcoming meeting to forward a resolution to the full board on renovate versus replace. Additionally, just exactly how this project is going to integrate into the strategic planning outcomes that we had from our facilitated session a couple Saturdays ago, or almost a week and a half ago. The analysis with the finance committee in terms of funding options and preliminary budget from the design team once we get to that point. and then also a decision on location should you choose to replace. Obviously, if you choose to renovate, well, then the location conversation is kind of a moot point. So what are we doing as part of the discovery phase? We're collecting and evaluating the mandated services versus what services may or may not be discretionary versus services that are of need. An example of that would be, for example, WIC. WIC, there's no mandate to do WIC, but if the health department doesn't do WIC, it doesn't get done. And so there's no one else in the community to do that. Plus, we'll look at of those programs, which ones are grant funded and which are not. Now, to what degree they are grant funded. We'll also be collecting demographic, and we are collecting demographic and geographic data for customers and clients of not just the health department, but also the coroner's office and the regional office of education, as an example. Beth provided last week geographic data on everyone that's received a GED through her office in the last 4 years, I think 3 or 4 years. So we'll that's just one example of multiple data points that we're collecting, and that will then be analyzed. We're also looking at how we define some of those service levels, because that's going to drive the footprint of the various divisions in the health department and the coroner's office and the regional office of education. We've got this meeting today, we'll have the report delivery meeting next month or the following. And then you've got an action item a month after that. We want to give you a month to kind of digest and chew on the report. And then we'll do the location analysis at a future meeting as well. And then we'll have the recommendation, should it be needed, on location. So that's a very high level of where we're at and what the team is doing right now. At this time, I'd like the team from Farnsworth to come up and just kind of give a quick overview in terms of how they're working through the various stages of that analysis. Don or Ellen, who's going to come up and do it?
Scott, Alicia did send the TOC to your email if
okay,
you
great.
would like to pull that up as well. So as Scott mentioned, as an introduction, by the way, I am Ellen Spencer, formerly Ellen Adams, been married all of 2 months. So I am with the Farnsworth team. I'm an architect there and then also the project manager for this new project. And as Don's here as well. He's our business development guy. I think you guys have met him since last time. As Scott has mentioned, we are pulling a packet together. So as maybe he can pull up the TOC, but the beginning will definitely be programming, understanding your current square footages, if it's used efficiently, if we need more space, less space, which then can lead us into renovate versus new. Understanding if your current building is feasible for that, and if the functions that you need will be appropriate if we do renovate. And then other sections we are looking at are the demographics. So we're looking into travel times, different zip codes served, where people are coming from. So if you decide to build a new building, we also need to figure out exactly where that site would be best located. Let's see. Let me pull up the TOC on my phone real quick. We're also looking into your partners, both internally and externally. So that way, again, if we are joining the coroner's office or the ROE in your current facility, we need to make sure that we have enough space to do that. There we go. He was able to pull it up. Through Monica, there's also some external partners that we're looking at as well, some OSF or Unity Point spaces that we could use as a multi-purpose room. So allowing space enough for that. We're looking into the neighborhood and the community aspects. Definitely wanting to not just serve the staff, but also serve your end users and the community in which the building resides. And then eventually, if we decide to go to a different site location, then we have various building sites that we're going to rank that then correlates to what we're looking at in terms of the demographics and people served. And then eventually that will lead us to the recommendation. So this is really high level. We'll eventually give you a better understanding of the packet and the pages within it, but this for right now is the table of contents. Are there any questions?
Are there any questions for Ellen? Steve, go ahead.
Yeah, thanks, Ellen, for the start. I guess I had a few questions. I'll start with I guess I call the fundamentals of breaking down the services that we plan to provide from the health department into their categories, if it's the dental, or if it's the WIC, or if it's immunizations, or each of those. And then once we have those broken out, which should be pretty easy, you spoke about demographics, so kind of the who needs those services and where do they reside within the county for each service. And then the next step is the service delivery methods for each service. What's the best method to deliver that service, if it's immunization for children, if it's dental, if it's WIC, lead, whatever those services are. I guess I'd like to see that level of detail, so we don't just kind of throw it all in that we need to build one huge building and deliver all the services because we group them. Let's kind of walk through what are they, who needs them in the county, and what are the delivery methods available for each. There may be 2 or 3 or 4 delivery methods for immunizations. You know, a building where people come to, a remote building such as a clinic, a mobile service delivery, or we come to them. I don't want to make this too big of a project, but I'd like to at least walk through what's available, so then we can say, yes, we did our homework and we understand those items, so we cover those adequately. So that would be my first ask. And then you mentioned partners, both internal and external. Look at the services those partners provide and how we can collaborate with them. So if it's Heartland Health, for example, who resides with us in that facility, I know Heartland Health has other facilities throughout the city. Can we partner with them where, for immunizations, for example, in the partnership with Heartland Health, could they give those at their other locations on behalf of the county? And likewise, where we work together with partners and not just pull partners into our facility, but we work kind of with them, I'll call it. So those are my initial comments, and I'll pause at that point to see if you have thoughts or questions where you've already progressed.
The delivery method idea is a really strong one, and I've taken notes down for that. We are gathering all of the data in terms of where people are coming from, but definitely understanding if it's even with COVID vaccines, you can do it oftentimes in your car. So that's definitely something we will take a better look into. And then Monica actually has, similar to your suggestions on the partners, she's kind of alluded to that as well. Understanding if there's overlap in services, and then wondering if it's going to happen at the new building or a renovated building, or if those services could still just be provided through them at the external location. So, yes.
I'll just make one last. We brought up the coroner's office and the regional office of education. I think for the regional office of education, I don't see Beth still here, but we were looking at having a facility to put the current staff that currently resides across the hallway here and in a couple of locations of the administrative staff. But we also have a school, a regional school that is run by the county that's currently housed at Wildlife Prairie Park. I don't know if there's any initiative for ease of access, accessibility to the students who attend that school, to either put that at least in the thought process, not to say I want to build a school building, but if we look at facilities out there, because there's a lot of facilities and buildings in this community that are vacant. The Kroger building up on Wisconsin, for example, that became part of our food desert. There's other buildings that may be appropriate to move the school to if we, work with that in a bigger picture and make it more accessible to those students who are using that service. Just as additional thought that kind of scope into, I don't want to drag it out, but at least don't miss that opportunity. Thank you.
Yeah, thank you. I think at this time we're not wanting to relocate the school because we definitely think Wildlife Prairie Park is great for that use, but having multi-purpose rooms and things like that in our new building that could serve them as well is a great idea.
Scott, can you tell us how many different locations where the ROE resides? And she's in several locations?
Multiple. She has 2 spaces in this building. She has an administrative team that's not part of county government, so it's the off county government enterprise that she operates that has space in right at the Kickapoo Edwards exit of Interstate 74. And then and I think most of that that staff deals with the virtual high school that the office operates and runs on behalf of the state of Illinois. And then, of course, there's Wildlife Prairie Park. Those are the 4 that I'm specifically aware of, but as we continue to go through the fact-finding and data gathering process, there's meetings and interviews scheduled or to be scheduled with both Beth and Jamie to better understand their operations.
So Beth is wanting to bring everyone together.
Correct. Yeah, Beth has been looking to consolidate for quite some time.
Okay, thank you. Are there any other questions? We'll start with Linda.
One of my concerns is we can identify the customers that we have coming to the current location, but how do we evaluate people, let's say, who live in rural Peoria County, who do not have transportation to take advantage of the programs there? How can we identify what that number is and take that into consideration in all the things we're discussing?
Scott might have to help me with this answer. I do think some of the zip codes and the data we've been getting are for your rural locations. So a lot of the statistics that we have on file do count for everyone living in the county. And then in terms of transportation or not having that said transportation, we might have to study that a little bit further just to see how those services can be reached to those people.
Well, and I guess I should have asked my question in a better form. I'm not really asking you to answer it now. I'm saying I think this is something that I'm hoping we're going to take into consideration.
Absolutely.
Either doing a survey, or would you take advantage of what, lead abatement, vaccines, whatever it is, if you had an opportunity to do that, even if you don't have transportation.
Okay.
Kate, you want to go next?
Great minds think alike, because I was going to ask basically the same question. From what I heard, it sounds like you're evaluating who is coming to the health department. I'm also concerned with who isn't coming to the health department and what are those barriers. So basically the same thing that Linda just said.
Yes,
Rob,
thank you.
Go ahead.
Thank you. Is this working? It got taken to the floor earlier, so I wasn't sure if it was working. Something that is important to me is not only looking at the coroner's office and the regional superintendent's office. Those are the 2 biggies that we're looking to maybe bring onto the campus, but maybe other smaller structures that we might have single departments in. We have no money really for capital improvements. So the one thing that comes to mind is the election commission. It's in a building that we lease. There's been rumors that we may be looking at buying it. I wouldn't support buying another structure that we can't maintain. I think if we can put the lease money towards maybe space in this new or potentially renovated building, I think it would serve our constituents well. So if there's any other, that's what's coming to mind, but if there's any other services that we're providing elsewhere that we could consolidate into this building, I would be interested in.
Okay. We can definitely add those to the list. That would probably fall under the partners category, both internal and external, and then we can put notes within the packet to say if we plan to relocate them.
Scott, we also talked about the Children's Advocacy Center. Is that going to, has a decision been made on that?
Not yet, because part of the process will be to talk to the state's attorney who manages the Children's Advocacy Center. Currently, it's a function of Jody's office, and I know Jody has shared that she has some ideas on how she can deliver those services a little bit differently, but we haven't had the opportunity to really discuss in detail what that might be. So, again, that's one of the many things on the to-do list.
Okay, thank you. Anybody else? Rachel?
So I know this is going to echo the thoughts that have already been expressed, but I know for me personally in thinking about this, as I drive, even my drive here today, I think about the number of buildings that I see that are vacant and the opportunity that we have to do that. So I know from a perspective as we look at locations and also transportation, being able to have access when we are able to get more information about who's utilizing our services, and also, as several others have spoke about, who could potentially. I know for me personally, one thing that will give me a lot of peace is being able to look and say, when we're able to get to the point of realizing that entire scope of work, then what do we have currently available to us as well? I know that there's obviously the opportunity to build in the same location, but what do we already have that we can use and leverage in our community? As we drive around, we see, again, depending on what the needs end up being and what scope of services we have, using what we already have available in our community.
Correct. And in our current building section and the table of contents, we have outlined various buildings in which we think we could potentially build this building, both in terms of new sites and existing. So, and then through our ranking system, understanding what the needs are, and then developing the pros and cons appropriately, so that way we can truly evaluate if moving into that building is the right thing to do. That's currently in the program. Yeah, absolutely.
Eden?
As we gather data on everything mentioned, I'd also like to know what's the consequences of moving it for that community. So if the campus is moved, what happens to that space if we were to move into property that right now is taxable, that's retail space, like the Kroger? What kind of tax revenue loss is there for something like that? So I want to look at those consequences as well.
Understandable.
Okay. Anyone else? Comments, questions? Okay. Then we will move on. Thank you. Ellen?
Thank you all.
So we are at miscellaneous. I did want to bring up one thing. And thank you, Steve, for bringing this to my attention. Last month we had Mike Beers with Triad, Peoria County Triad here. And he had talked about asking for a donation from us to help with their expenses in their mission. So I wanted to get thoughts from the committee on this, if we wanted to do something, or do we want to come up with a number and then we'll make a resolution and we'll bring that forward next month. So I'd like to get some thoughts. We'll start with Rob, because I know you'll have something to say.
I think this is it's a great organization to help our seniors and provide opportunities to educate our seniors and make sure they're being taken care of. I would like to see a $2,000 donation go to them. I think that's the only thing that's stopping them getting their wheels going is just an initial investment and then reevaluate.
Yeah, I guess
I need to turn my mic on.
Yep. I don't have any pros or cons of donating or not donating to this organization. I know we've had requests from other organizations, nonprofits and such in the past, and we've always said we need to make sure it fits in the scope, because once you start offering money to nonprofits, who makes the decision within the county of yes, we like these people, but we don't like these people. We'll give here, we don't give there. And I don't know, I know, we had some educational programs we funded and some other things in the past that created some tension among board members. So I guess not wanting to make this a political battle, but as long as we're comfortable that we can explain why we picked this organization and we didn't fund 3 others, that's probably my only, I'm not giving a good answer, but I'm at least kind of putting it out there so we don't set ourselves up to cause frustration among board members or other nonprofits in the community that we've said we can't fund everybody.
Okay, any other comments? Betty?
Do we have any type of allocated funding that accommodates a donation such as this? Is there a purse? And then in considering the amount, is there a certain percentage that we then overall give to each one? Like as Steve mentioned, as Rob as well, percentage, then we can say, okay, we can give a certain amount to whoever asks for it.
Scott, do you have an answer for that?
We do not have a dedicated fund or source of revenues or program where we make donations such as this on a regular or one-off basis. We budget money for various memberships such as whether it be PUATs, which Mr. Salzer's committee took up yesterday, and then we also have money where we choose to make donations in memory of someone that's passed away. Like, for example, when Bonnie Noble passed away a couple weeks ago, the longtime executive director of the Peoria Park District, the board made a donation, or we made a donation on behalf of the board in her name to the Park District Foundation. So we do things like that on a case-by-case basis, but we don't have a dedicated bucket of money to do something like this on an annual basis.
Eden?
I think if we give a small amount, like $2,000, to get them started, it should be considered kind of a seed fund, and that we're clear then that this is to help you get started, not something annual. It's just a jumpstart kind of donation. And is there a difference between a donation and a grant from the county? Are there different terms for that?
Only in semantics.
Okay. Rob?
I agree with Steve that I think that we should support people that kind of encompass our vision in some of our services. I believe that Triad does that kind of across a couple different services. As far as public safety, I don't know. I'm probably going to get it wrong. Mike had talked about it. Is it called the Blue File? I don't know if anybody remembers. But it's a file that they help seniors put together so that if emergency response has to enter their home, it's readily available with all of their pertinent information to help provide service to them. And then it also, for for security, it goes over cyber crimes and tries to help prevent our seniors from being targets and being able to identify when somebody is trying to either take money from them or any other kind of cybersecurity that seniors fall victim to.
Okay. Any other comments? Phil?
I think the presentation really was a good one, and it's something really worthwhile. I personally would like to support it. I question what some of you other people are saying. Where does it stop in our donations and so forth? I like the idea that it can be seed money to start this organization, because we do have other programs in the county that try to help different groups. The senior citizens, frankly, and I'm not one of them, but I think a lot of senior citizens are forgotten. They're nearing the end of their life. Everybody goes overboard to help young kids, and they're the future of this country. And I always try to donate to things such as that. The best example, I think, is St. Jude. boy, do we have a bandwagon there with St. Jude. But I don't see too many bandwagons for senior citizens. And this is bandwagon. This could be it.
Okay, so are there any other comments? Go ahead, Rob.
Just one last one. I don't know if we should call it a seed money though, because it is an organization that's been in existence for a while. It's kind of like a revamp of it. There's new blood in there, so I don't know if seed money is quite. But
We don't have to call it that, but that kind of idea that we're using this to leverage greater activity from the group rather than something where we're just feeding them money every year.
So what I'll do is before we meet the next time, I'll reach out to all of you just to get your thoughts on and your opinions on what we should do with this. And then we'll have a resolution come forward next month. Is everybody okay with that? Okay. All right. Any other miscellaneous? Okay, we're adjourned. Thank you.